Good morning, everyone. Thank you so much for inviting me to come here and talk a little bit about the brain imaging study that we have been doing over the past 3 years. Actually, it was almost 3 years ago today where we came to this type of meeting. It was a summit, and we recruited pretty much the first 50 players that were in this study. And my goal here today is not just to tell you about how playing professional football can cause brain damage, but really I want to share some stories of hope and inspiration that we can rehabilitate brain function if you follow a very regimented protocol. Now, this is going to take you, if you're a player, being proactive, right? It's not going to happen on its own, but we've been working with these players now for over 3 years and have shown tremendous improvements in cognitive abilities, ability to sleep, more energy, better focus, and ultimately, we want to help prevent advancing into neurodegenerative diseases, which we've really started to see in a small percentage of our players. So, as Robert Lee has said, my name is Dr. Kristen Willeumier. I am the Director of Research for the Amen Clinics. My background is in neuroscience, so I have a Ph.D. from UCLA in neurobiology, and I used to work on understanding molecular mechanisms underlying Parkinson's disease. So things like brain trauma and traumatic brain injury are very familiar to me. I understand how neurons degenerate in the brain. Dr. Daniel Amen is a board-certified psychiatrist and has been using brain imaging in his clinics for over 20 years. So at this point, we've scanned over 70,000 patients, and we have a pretty good idea of what brain trauma looks like in the brain. Okay, Robert, you want to advance to the next slide? So our NFL story started back in 1991, and you're going to have to kind of click several times with each slide. So we started our SPECT imaging work about 20 years ago and recognized that brain injuries are really a common part of psychiatric practice, right? So many people who have come in do have issues with depression, ADD, that's from brain trauma, anxiety, and memory issues. And Dr. Amen has seen many kids who played Pop Warner football, high school, collegiate football, as well as NFL players who had brain injuries on their scans, which ultimately resulted in troubled behavior. So here's an example of a middle linebacker who played at UC Berkeley, and he was arrested for domestic violence. So on the right, you see a SPECT image of a healthy individual. So SPECT is a nuclear imaging study. It stands for Single Photon Computed Emission Tomography. What we want to do is look at blood flow in the brain. So the image to the right shows even, symmetrical blood flow. Don't worry about the color. The color just tells you orientation. So the pink is looking from the top of the brain, and the green is at the bottom. In that image, we're actually looking at the top. On the right, you see the image of the player, and you see areas of low perfusion, which look like holes in the brain. So again, those holes aren't areas where neurons have degenerated, they're just areas of low blood flow. If you don't do anything to treat those areas, those neurons will degenerate and result in the cognitive issues and the dementia that I know a lot of you are worried about. So all of you know O.J. Simpson, who was, right, once a huge American football star. You can advance the slides. But later on, as we know, he was on a criminal trial for murder, right, involved in drug issues and robbery, and was eventually sentenced to 33 years in jail. So many people have come to our clinic and said, wow, what if you scanned O.J. Simpson, right? Could you have changed this fate that he now has? So we've just recognized that a bad brain can lead to making bad decisions in life, which is why it's important to really get treated now. Okay, so let's go on to the next slide. In our study, we saw Ron Yari, and as you can see, Ron is 6'5", 255 pounds, and my boss, Dr. Daniel Amen, well, I don't even now know how tall he is, but I'll refrain from actually giving a height. But you can tell, imagine you were playing against Ron, right? And he's hitting you 30 to 50 times a game. That, in essence, is going to result in major traumatic brain injury. And interestingly, players like Ron, not only are they hitting each play a game, they're sometimes hitting 3 times per play. So imagine those number of hits over time are resulting in 20,000 sort of like mini concussions to the brain. Okay, next slide. So the NFL's position on brain trauma. So majority of you know the NFL started a committee, Mild Traumatic Brain Injury Committee, back in '94, and they were looking to ask the question, does football cause long-term brain damage? You know, studies are needed. But interestingly enough, in 2009, they still had the same position and same question, which is when we actually decided to start our study. So the NFL is really acting like employers with workman compensation claims. They delay, deny, and blame the employee, right? So they're blaming the football player. Oh, he's on steroids, right? He's an alcoholic, or he's just lazy. That's why he has problems with his brain. Okay, next slide. So the problem with the NFL's position is that if you don't admit to having a problem, you really can't do anything to solve it. So many brain damaged retired players are currently left without help or hope. And just as a personal note, you know, this year, Chicago Bears player Dave Duerson shot himself in the chest and asked that his brain be sent to Boston University to be studied for chronic traumatic encephalopathy. And what's so sad about that story is that he really felt that there was no hope. He honestly believed there was nothing that he could do for his brain. And what I'm here to tell you today is there really is. So next slide. So back in 2000, Brent Boyd came to see us. He's an offensive guard for the Minnesota Vikings and had played 6 seasons. So he came to see us for issues with headaches, depression, fatigue, memory problems, dizziness, and like many of the players in our study, he was overweight. So here's an image of Brent Boyd's brain. So now on the right is a healthy brain, but we're looking from the underside. So before we were kind of looking from top down. If I take the brain and sort of flip it, we're looking at the underside. And you can see in Brent's brain, up at the top, you see low blood flow. That's in the prefrontal cortex. Kind of in the middle, those are your temporal lobes. They're all sheared. Those are the areas of mood and memory. And even at the bottom, you see sort of that divot in the bottom, that's the cerebellum, which is an important and coordinated thought as well as coordinated movement. So the NFL's hired doctor said Brent's scans meant nothing. He said that his problems were not work-related, and they basically denied his claim. So now Brent gets traumatized twice. Once for the brain damage he suffered from playing professional football, and second, by them denying his claim and basically calling him a liar. Next slide. And I just want to say, so Brent in 2007 was actually the first NFL player to go before Congress and really talk about brain injuries. You know, he really brought it to light. He talked about the brain injuries that the young kids are having from Pop Warner, high school and college, all the way to NFL. And prior to that, all they talked about were the postmortem studies, you know, that were done on players. And, you know, postmortem, we feel it's too late, right? We need to do something now. Brent had talked about coming to the Amen clinics, you know, and said Dr. Amen was the first person who actually diagnosed him with brain trauma. So then in 2007, we had Anthony Davis come and see us. So a lot of you know AD. He was a college football Hall of Fame running back from USC, an NFL player. Next slide. So again, on the right is a healthy brain, and on the left was AD's brain. So at 58, AD's brain looked like he was 85. Now, interestingly, AD came to us and he really wasn't having tremendous memory problems at that point, but he saw all of his colleagues and he was afraid, right? He saw guys he played with who were really suffering from dementia, and it scared the pants off of him. And he's like, Doc, please, you gotta help me. Like, what can we do to help my brain? And it was really AD who started getting us thinking about this issue and saying we need to do this on a greater level. So what we did with AD is We put him on what we call just a pragmatic rehab protocol. So we got him to exercise, clean up his diet, and we put him on a set of supplements to help improve blood flow to the brain, antioxidants to protect the brain, and something to boost his memory. So then he came back to see us a year later, and on the right is a scan before treatment. And on the left, this is 1 year later. You see all those areas of low blood flow, right, are now boosted. So essentially, from a year of taking supplements, he made tremendous difference in blood flow to the brain. So because AD was so excited about his results, he got Dr. Amen to come and speak at the Los Angeles chapter of the NFLPA. And at that meeting, Dr. Amen recognized there were a lot of players who needed help. So this is when we started to realize somebody needed to answer the question, does playing football in the NFL actually cause brain damage? So we ended up teaming up with Reggie Berry, who at the time was the outgoing president of the LA chapter of the NFLPA, and Marvin Smith, who was the incoming president, along with Dr. Joe Wu, who's head of the PET Imaging Center over at UC Irvine, and decided to design a study studying brain trauma in NFL players. Next slide. So the LA chapter initially helped us recruit the first set of players. So the next question is, who funds the study, right? So the first arm of the study was paid for Dr. Amen personally to ensure its independence. So we estimated the cost per player would be about $5,000, and many of the people who worked on the research team donated their time. So initially our goal was to study 30 players. We thought, okay, that would give statistically significant results, and we could answer the question, right, does playing football in the NFL cause brain trauma? Once we started working with the first 15 players and saw how bad their brains were, we decided we needed to have a rehabilitation component as well. So we kind of started the second arm of the study, which I think is more exciting to a lot of you here. Can we rehab the brain? So when players came in, they underwent several tests. We had them do a brain SPECT image, which is imaging blood flow and activity patterns in the brain. We had them do an attention test called the Conners Continuous Performance Test. We did something called a QEEG, which measures brainwave activity, so it's another way to measure brain function. Keep going. And then we had them do 2 cognitive tests. So this next one here, the mild cognitive impairment screen, is actually a short-term memory test. It tells us if somebody has dementia. So it's a very good test to indicate that, as well as a very sophisticated neurocognitive test called the microcog, which I really like. It's very difficult to do. It's computerized, and it tests across 9 different scales. So general cognitive functioning and proficiency, information processing speed and accuracy, reasoning, attention, memory, spatial processing, and reaction time. So the current status of our study. So as of today, we've worked with 115 active and retired players. We've looked at players from all 27 teams, age ranges as young as 25 and as old as 85. We had guys who played back in the day where they had the leather helmets that they took off and folded and put in their back pocket. So we spanned many generations. Next slide, please. So then we asked the players to report the number of concussions they had, as well as if they've lost consciousness. So, okay, every player's gotten their bell rung, right? But but when we ask about concussions, that really means, did you have a play where you had altered mental status? So of the players in our study, 14% actually reported they've never had a concussion. 1 to 2 reported, or 24% reported they had 1 to 2 concussions. 19% reported they had 3 to 5 concussions. And 43% of our players reported 5 or more concussions. So here's some of the important numbers we got when we analyzed the data. So first and foremost, 48% of our players were obese, as measured by waist to height ratio, which Just so you guys know, fat on the body is a disaster for brain health. We actually just published a study looking at our NFL players. We compared normal weight players to the overweight players and matched them by position, and the overweight players had damage to their frontal lobes, which is sort of like the brain's president, and the temporal lobes, which are your mood and memory centers. So it's really important if you're overweight to get that under control. 30% of our players had sleep apnea, and interestingly enough, they were diagnosed and their CPAP just sits in the corner, right? They don't even use the thing. So sleep apnea is a way to just walk right into dementia. It really accelerates brain aging. 28% of our players were suffering from depression. Many of them were not even treated. 19% showed clinical signs of dementia. 81% scored abnormally on that Conners Continuous Performance Test. So that's the test for focus and attention, which made sense to us, right? So if you're hitting your head into a guy's chest several times a game, that's going to result in problems with focus. And on the microcog, that sophisticated neuropsych test I told you about, many of our players scored below average at all of the categories, with the exception of spatial processing and reaction time. So interestingly enough, all of you guys who play in the NFL, you're elite athletes, right? So spatial processing is being able to track a ball in space quickly, and reaction time is how quickly you move off the line. So pretty much across the board is where you guys excelled. So here are the outcomes. Of the participants in our study, 90% had a brain trauma pattern on both SPECT and the QEEG. We showed severe decreased activity really across the whole brain. I'm talking the frontal lobes, the temporal lobes, the parietal lobes, which degenerate in Alzheimer's, right? The occipital lobes, which are for vision. Inside the brain, the anterior cingulate and posterior cingulate gyrus, and the hippocampus, which is involved in memory. So really, it's significant brain trauma. What we did is we compared these players against a group of normal, healthy brains. So the next slide. So the results were highly statistically significant. I mean, they were undeniable. But of course, we knew that. This really wasn't a surprise to us. So here's the illustration of an image. It's a 3D image of the brain, and you'll see, again, the areas of blue are all areas of low blood flow in our NFL players seen across the group. Right, so you can go to the next slide. These are just horizontal sections throughout the brain, and again, the blue shows areas of low blood flow. So you can go to the next slide. And this is just an individual example of a player, a 20-year player, Hall of Fame, defensive lineman. You see significant low blood flow to the brain. Next slide. Oh, so this next series of slides are just SPECT images from players in different positions. And the way I put these slides is I wanted to show you the players who had the worst brains. So the offensive linemen are by far the worst. So this is someone who played 12 years in the NFL. You see the frontal lobes, again, kind of up at the top, have those big, right, gaping holes. The next position that was worst was running back. So here's someone who played 4 years in the NFL. You see that big sort of like divot, looks like a dent in the prefrontal pole. Again, that's from hitting hard with the head. Here, the next player was a defensive back. So this is an individual who played 3 years in the NFL. Again, kind of on that lower left, you see low areas of blood flow all throughout the top of the brain. And then again on the sides here, the temporal lobes, again, those are the mood and memory centers. So right, you see players who have real issues with temper problems and managing their anger, as well as memory issues. That's because those temporal lobes just get sheared. Okay, next comes the linebacker. So here's someone who played 10 years in the NFL. Okay, next slide. So the ones that don't have quite as much damage to the brain are your wide receivers. So you see the perfusion is much better here. Again, you still see issues in the frontal lobes and temporal lobes. Next slide. Tight end who played for 8 years. And then last slide. So the best brains in the NFL were our quarterbacks, right? Those are the ones that are protected the most, right? Take the least amount of hits per game. And you can see here someone who played 18 years in the NFL. So for 18 years, and then you're also adding on college, right, and high school, they really are the best looking brains. Really the best looking brain is the guy who sat on the bench, right, the second string quarterback. And we had that. We actually had a guy who came in and he was so upset. His brain looked beautiful, but he just didn't feel good about himself because he never got to play. He even had a Super Bowl ring. So Dr. Amon's like, oh my God, we actually thought it was a mistake when we saw a scan because it looked so good. So if you happen to spend, actually the kickers were not so bad either. But it just depends on how much time you played too. Okay, so this is really an illustration sort of all those slides together. So it's our classic NFL pattern. We tend to see damage in the prefrontal cortex, so that's up top here. So that's the area of judgment, focus, and impulse control. And then you see there in the middle, those are the temporal lobes. So those are the areas of memory, learning, emotion, and moods. Those are the worst, right? And then at the bottom there, that's the cerebellum. So that's the area of physical coordination and thought coordination. So that's really what we call our NFL pattern. Next slide. Okay, so here are the really exciting results, right? The brain rehabilitation program that we put everyone on. So we recognized the damage was so high, we added a pragmatic rehab component, meaning, you know, we wanted to treat the players as if they were coming in as a patient in our clinic, right? Not just somebody in a study. Move forward, please. So we had several brain healthy strategies. You can list all of these. So I ran a weight loss group for my NFL players. So for 2 years, every 2 weeks, I'd have these guys call me up and I'd teach them all the things they needed to learn about how to lose weight. And trust me, that is so important. I can't even express to you how important weight loss is. We had them do coordination exercises. So I talked about the cerebellum, right? The cerebellum's in the back part of the brain, houses 50% of the brain's neurons, but it makes connections to the frontal lobes. So you saw those frontal lobes were a disaster, right? So coordination exercises works the cerebellum, which then helps the frontal lobes. So things like tennis, table tennis, yoga, tai chi, juggling. You can even go to the gym and do specific coordination exercises. That will boost brain function. Next, again, we put them all on a healthy diet. And, you know, I found teaching my weight loss group, most of my NFL players were taking in about 4,000 calories a day. So we keep them down between 1,800 to 2,000. I know, training tables, right? You were taught really early how to eat mass quantities of food, but then don't learn how to scale that back. We recommended sleep apnea evaluations for a lot of players. If we saw a toxic scalping pattern on the brain, we knew it could be sleep apnea related as well. And we recommended they avoided toxic substances like drugs, marijuana, alcohol, no more than 2 glasses of alcohol a week. That's really important because alcohol, you know, your brain's already vulnerable, right? And so we don't need to do more things to accelerate brain aging. Next slide. We also put everybody on a high potency multiple vitamin. We put them on a therapeutic dose of fish oil. So if you're going to take omega-3s, fish oil, you got to make sure you take enough to actually do something in the brain. Fish oil will help reduce inflammation in the body, so it actually will help with weight loss. But it also expands blood vessels, so you get more blood flow to the brain, and it actually repairs neurons in the brain. So I'm a big fan of fish oil. And we actually put them on a brain enhancement formula that we designed called Brain and Memory Power Boost. So it's got things to boost blood flow, which is what vinpocetine and ginkgo biloba do. It's got phosphatidylserine, which helps rebuild cell membranes. It's got huperzine A and acetyl L-carnitine. So those boost acetylcholine, which is the neurotransmitter for memory. So if you guys are having memory issues, you really need acetylcholine. And it's got antioxidants, the N-acetylcysteine and alpha-lipoic acid, which will actually protect your neurons. We then made other recommendations for individual players based on their needs, such as treating their depression, anxiety, alcoholism, ADD, and dementia. And we also recommended neurofeedback and hyperbaric oxygen for several players. Okay, so here are the preliminary results of the rehabilitation protocol. So this is the first 30 players that we got follow-up testing on. We did scans and their cognitive tests, and this was after about 6 months on our program. So we found that 25 of the players showed improvement in a variety of areas, such as memory. Robert said, asleep at the wheel. Memory. It's your memory. Memory, motivation, sleep, attention, and mood. So that's the percentage increase that people had after following our protocol. And remember, I mean, I really held their hand. I made sure everybody was compliant. They stayed on their supplements. They stayed on the weight loss protocol. And the images to the right are figures. So if you could look up at the top, the black and gray circles actually represent areas of increased blood flow to the brain. So you see all sort of across the brain, right? You're getting increased blood flow. And the images sort of at the bottom, the yellow and orange also illustrate increases in blood flow to the brain. So we see it a lot in the frontal lobes, temporal lobes, in the back, and the cerebellum. And that's only after 6 months, right? Imagine when you stay on these programs for a year, 2 years, 3 years. Okay, Robert, keep going. See, keep going, Robert. Perfect. Okay, so here's an example of the microcog test and how our guys scored on this test. So remember, I told you this is a very, very difficult test. I'm telling you, it's not easy. So the microcog I listed there in the far left, the general cognitive functioning, proficiency, processing speed, processing accuracy, attention, reasoning, and memory. All of our guys increased across those levels. So let's look at general cognitive functioning. The before score shows 31.8 percentile. After 6 months on the program, it increased to the 43.4th percentile, so that was statistically significant, and 14 of our players actually scored 50% or better when they came in for follow-up. So that's how you read this slide. I want to kind of bring you down to memory there. So in memory, before, they scored in the 33rd percentile. After 6 months, it boosted to the 42nd percentile, and you saw 17 of the 30 players scored in 50% or better when they did the follow-up tests. At the bottom, that spatial processing and reaction time, remember I told you pretty much all of our NFL players scored very high on those, and you can see in their initial testing they were at the 69th and 70th percentile. So those scores improved as well, but they weren't statistically significant. Okay, now I'm going to actually show you some individual tests. So this is Elston Riggle. He was 45 at the time he saw us. He played 6 years in the NFL as a defensive end. You can see general cognitive functioning. Before, he was at the 39th percentile for guys his age and education level. After 6 months, he boosted it to the 61st percentile, so that's a 56% increase. But I want to bring you kind of down to the bottom there. In memory, when he first came in, he scored at the 25th percentile, but he boosted it all the way to the 73rd percentile, which is excellent. We were thrilled. That's a 192% increase. So can you see, when you take a supplement that really boosts acetylcholine to the brain and boosts blood flow to the brain, it has great effects on memory. Next slide. So here's Big Ed White of the Minnesota Vikings. I know a lot of you know him. He played 17 years in the NFL. When he came to see us, you can see information processing speed. He was at the 25th percentile. He boosted that to the 58th percentile. His memory went from 14th percentile to the 66th percentile. That's a 470% increase. So when Big Ed White came to see us, he weighed 365, and he is, I believe, 6'5". So this image is of him 40 pounds lighter, and I just talked to him before coming to the conference. And go to the next slide. I now call him Little Ed White because he's lost 80 pounds, so he's now 285. His goal is to get to 265. Big Ed, he was great because he was in my NFL weight loss group. He eats 1,700 calories a day, totally clean, and he's just so happy. So not only did he do well on his tests, he leaned out, he's improved in memory, His sleep is better. And he said if any of you guys know him, you can feel free to call him, and he'll help you out. John Hauser came to see us. So John was 74. So we have some older players here who actually came in, and his general cognitive functioning when he saw us was at 19th percentile, and his follow-up was at a 42nd percentile. So that's a 121% increase. And look at his attention. Went from the 12th percentile to 58th. So that's a 383% increase. So we were really proud of John. And I've seen him here today, and he's down 30 pounds too. So we're really proud. Way to go. And last but not least, someone who's even a little bit older than John, Gerd Nagler came to see us. So Gerd Nagler was a wide receiver, played 7 years in the NFL. So he was 77. And you can look, his initial scores coming in were really high, which is impressive. But again, remember, wide receivers, their brains don't get as bashed up as the linemen. But after our program, you could see all of his scores increased into the 70th and 80th percentile. So it's really impressive. We're very, very proud. Next slide, please. So again, I wanted to show you some examples of spec scans, the improvements before and after. So here's somebody who was a tight end, played 8 years in the NFL. This particular individual was knocked out and lost consciousness for 18 hours. So he had also suffered 8 concussions. You see his image on the left, the before scan. You see the back part of the brain. There's areas of low perfusion. And in the back, when we see here that there's low perfusion in the parietal lobes, we get very concerned because that's sort of our indicator that you're 10 years out from dementia. So when we see that particular region down, we get real serious about treating the brain. Now you can look on the right, see how there's more perfusion in his brain. And his was after eight months on the protocol. Also, he had severe issues with depression, so we helped treat his depression. He was feeling better, interacting more with his family and his kids. And that's another thing we see with the players, right? So you're depressed, you have memory problems, it's hard to hold a job, you have trouble relating to your family and even managing your kids. So we're very sort of proactive in helping the players get everything under control. Next slide, please. Here's somebody who was a tight end, played 10 years in the NFL. This person went to 5 Super Bowls. And you could tell he's suffered from some significant brain trauma, as you can see by the areas of low perfusion on the brain. And if you look 18 months later, this person followed our rehabilitation protocol. He also did some hyperbaric oxygen. So at this point in this scan, he had done 40 sessions of hyperbaric oxygen, which you're going to hear a little bit about later. In this slide is an offensive tackle who played 12 years in the NFL, was a starter, and you can see the horrible brain trauma. We actually had him come back, and after 18 months, this particular player lost 100 pounds, which was really important, and all he did was follow our supplement protocol. So he had tremendous improvements in blood flow to the brain. This is the best we could have ever asked for, right, for this particular player, and he's thrilled. Next slide, please. So here's another example of somebody who's gone through 40 sessions of hyperbaric oxygen. You see on the left there areas of low perfusion, and on the right you see how the hyperbaric oxygen has now helped increase blood flow to the brain. And we're going to have somebody come up here, Dr. Duncan, and talk a little bit more about the benefits of HBOT therapy. But what we've really seen is 40 sessions starts to improve the vasculature in the brain and improve the blood flow. And we've got many players who've done over 100 sessions of hyperbaric oxygen. So not only does it help boost blood flow to the brain, but it really helps improve their sleep and their energy and their mood. Next slide, please. So conclusions. So based on our sample, playing football in the NFL really puts NFL players at risk for brain damage and long-term cognitive and mood problems. Next. The exciting part is that we recognize the brain has the ability to improve and rehabilitate when you're on a comprehensive program. Next slide. So we feel that more studies are immediately needed to evaluate the components of our study and other great interventions like the hyperbaric oxygen, neurofeedback, and medications that, such as memantine, which is a stimulant, and memantine, which will help improve acetylcholine and minoxidil, which is the stimulant. Next slide. So we feel that general brain health principles should be taught to all active and retired NFL players. And the reason why that's so important, we actually see guys who are currently playing that have been asked to step out of the game because of concussions. So then they've come to us to help so they can get back and play in the game. So it really is important to come in and get treated. We feel that more intense brain rehab needs to be offered to current and former players. And targeted supplements such as the omega-3s, a comprehensive multivitamin, and some type of brain enhancement supplement like the ones we used, I think are really helpful in the long run. Next slide. And we think it's really important to start using the brain imaging tools that are available to evaluate brain function, like SPECT imaging and QEEG. So the implications of our studies go way beyond the NFL. They can be included for kids playing at the high school level and collegiate athletes. It extends to the military personnel, so over 15% of soldiers that return from Iraq and Afghanistan, right, have brain injuries. And over 2 million people a year are diagnosed with brain injuries. So this study is really helping them as well. Next slide. So we always say, what if the NFL and the Amen clinics collaborated? We have a wonderful cohort of guys that we still work with. I mean, once you come to our clinic and work with us, we think of you as part of the family. So we have a waiting list of, I have dozens of players. I have close to 100 who would like to come in and get scanned for free, but we know we could easily recruit hundreds of more players because they trust us. Next slide. We could do things like diffusion tensor imaging, which is actually looking at the white matter tracts in the brain. I mean, you can see what kind of damage happens. We've already started doing those studies, as well as testing the genetic markers that predispose people for brain trauma. But we're always open to collaborations and working with people that can help us design better studies. You know, we're always looking for funding to continue this work because we feel it's really important. Next slide. So if I was the commissioner, although I don't know that I want to be the commissioner, we'd be an advocate and a leader for brain health among football players and really stopping the bad press and replace it with genuine care and concern for these people. We think it's important to invest in unbiased studies with researchers who have a sense of urgency, like us. And we think it's important to evaluate all players coming into the league to basically establish a baseline level of brain function. Next slide. We think it's important to treat concussions early and effectively, so the minute you have one, the sooner you get on a brain rehab protocol, the faster you can either get back to play or get back into life. So we think it's important to work to identify retired players who are troubled and to really get them the help that they need. In the long run, it'll be less expensive, and we feel that getting tied up in the courts and legal battles can be time-consuming. Next slide. Okay, so if you're sitting in the audience, you're like, okay, I've heard your talk, what do I do now? So, and Robert, you can kind of hit all of these. The important thing is part A, stop doing things to hurt your brain, right? Brain injuries, try to prevent them. Drugs, don't do them. Alcohol, no more than 2 glasses per week. Your brain is vulnerable. Obesity, if you are overweight, get lean. Sleep apnea, if you have a CPAP and you're not using it, start using it. There's the CPAP Pro, which I promise you is not as bad as the whole mask, because sleep apnea is the fastest way to get dementia, I promise you. Next slide. Smoking, stop smoking. Smoking constricts blood vessels, so it reduces blood flow to the brain. If you have high blood pressure, issues with diabetes, you need to get those treated. Keep going. High sugar diet. Sugar is toxic to the brain, so really keep the sugar down to a minimum. If you have any exposure to environmental toxins, toxic mold, you know, that's a disaster for brain health, so get that treated. Try and manage chronic stress. I know a lot of football players have it, right? So we've sat down and actually worked on action plans to help people get a hold of their stress in their life. If they, you know, are having marital problems, don't have a job, we've actually sat down and said, A, B, C, D, and E, here's what you need to do. I think people are afraid to do it, but we kind of force the players to work with us on that. And lack of exercise. I know a lot of players have trouble exercising. I pushed a lot of them into the pool and just said, use a kickboard. I don't care if you go up and down, but you got to get exercise. It boosts blood flow and oxygen to the brain. And here's the part B. So here are things you could do to start helping the brain. You can kind of go through these. It's important to maintain your social connections. So a lot of players kind of go inward, right, and don't stay connected. So we've recommended that they go ahead and help teach football, right, at the high school level or college level. New learning, brain training games are a great way to stimulate new neural connections. A lot of the guys in our study, we actually allow them to go on our website, and we have all kinds of brain training games. Stay with a great diet, right, things that you can, get from a tree, a plant, stay away from processed foods, keep the calories between 1,800 and 2,000. Next. Calorie restriction is important. It will help extend your life. Next slide. A therapeutic dose of fish oil is very, very important. If you do take nothing away from me, just start doing omegas, high-dose fish oil. I promise you it'll help you in the long run. Taking supplements, brain enhancement supplements, and vitamin D is another amazing supplement. Everybody should be on vitamin D. Green tea actually helps protect the ends of your DNA, so it's great for anti-aging. Exercise, right, number one way not only to boost blood flow and oxygen to the brain, but it's also a natural antidepressant. So people don't know exercise boosts serotonin. So if you have issues with depression, it's the easiest way to get rid of it. Coordination exercises to work your cerebellum and your frontal lobes. Keep going. Practice gratitude, everything that you're thankful for, that helps boost blood flow to the frontal lobes. So does meditation. And last but not least, please get a healthy sleep. The sleep is probably the number one thing that people have problems with. You really need to get 7 to 8 hours of sleep. It's really important in the rehabilitation process. So I just wanted to thank all of our players, some of whom are sitting here today, who participated in our study, as well as people who came from the LA chapter of retired NFL PA. And a big thanks to Robert Lee and Dave Pear. They've been amazing. Dave, on his blog, Dave came to see us. We helped treat him. He wrote about it. We're so thankful. And thank you so much for, inviting us to speak at this conference. And we also have to give thanks to the many doctors who participated in our studies. So, and the last slide is just my boss, Dr. Amen. So if anyone has any questions, you're obviously welcome to ask me, ask Dr. Amen. If people are interested in getting their brain tested, right now we're not taking players for free, but Dr. Amen is offering players to come in for half price, which is an amazing deal. So we will take care of you. Good morning, everyone. Thank you so much for inviting me to come here and talk a little bit about the brain imaging study that we have been doing over the past 3 years. Actually, it was almost 3 years ago today where we came to this type of meeting. It was a summit, and we recruited pretty much the first 50 players that were in this study. And my goal here today is not just to tell you about how playing professional football can cause brain damage, but really I want to share some stories of hope and inspiration that we can rehabilitate brain function if you follow a very regimented protocol. Now this is going to take you, if you're a player, being proactive, right? It's not going to happen on its own, but we've been working with these players now for over 3 years and have shown tremendous improvements in cognitive abilities, ability to sleep, more energy, electrical blood flow. Don't worry about the color. The color just tells you orientation. So the pink is looking from the top of the brain and the green is at the bottom. In that image, we're actually looking at the top. On the right, you see the image of the player, and you see areas of low perfusion, which look like holes in the brain. So again, those holes aren't areas where neurons have degenerated, they're just areas of low blood flow. If you don't do anything to treat those areas, those neurons will degenerate and result in the cognitive issues and the dementia that I know a lot of you are worried about. So all of you know O.J. Simpson, who was, once a huge American football star. You can advance the slides. But later on, as we know, he was on a criminal trial for murder, involved in drug issues and robbery, and was eventually sentenced to 33 years in jail. So many people have come to our clinic and said, wow, what if you scanned 1991? And you're going to have to kind of click several times with each slide. So we started our SPECT imaging work about 20 years ago and recognized that brain injuries are really a common part of psychiatric practice, So many people who have come in do have issues with depression, ADD, that's from brain trauma, anxiety, and memory issues. And Dr. Amen has seen many kids who played Pop Warner football, high school, collegiate football, as well as NFL players who had brain injuries on their scans, which ultimately resulted in troubled behavior. So here's an example of a middle linebacker who played at UC Berkeley, and he was arrested for domestic violence. So on the right, you see a SPECT image of a healthy individual. So SPECT is a nuclear imaging study. It stands for Single Photon Computed Emission Tomography. What we want to do is look at blood flow in the brain. So the image to the right shows even, better focus, and ultimately we want to help prevent advancing into neurodegenerative diseases, which we've really started to see in a small percentage of our players. So as Robert Lee has said, my name is Dr. Kristen Willeumier. I am the Director of Research for the Amen Clinics. My background is in neuroscience, so I have a Ph.D. from UCLA in neurobiology, and I used to work on understanding molecular mechanisms underlying Parkinson's disease. So things like brain trauma and traumatic brain injury are very familiar to me. I understand how neurons degenerate in the brain. Dr. Daniel Amen is a board-certified psychiatrist and has been using brain imaging in his clinics for over 20 years. So at this point, we've scanned over 70,000 patients, and we have a pretty good idea of what brain trauma looks like in the brain. Okay, Robert, you want to advance to the next slide? So our NFL story started back in O.J. Simpson, Could you have changed this fate that he now has? So we've just recognized that a bad brain can lead to making bad decisions in life, which is why it's important to really get treated now. Okay, so let's go on to the next slide. In our study, we saw Ron Yari, and as you can see, Ron is 6'5", 255 pounds, and my boss, Dr. Daniel Amen, well, I don't even know how tall he is, but I'll refrain from actually giving a height. But you can tell, imagine you were playing against Ron, And he's hitting you 30 to 50 times a game. That, in essence, is going to result in major traumatic brain injury. And interestingly, players like Ron, not only are they hitting each play a game, they're sometimes hitting 3 times per play. So imagine those number of hits over time are resulting in 20,000, sort of like mini concussions to the brain. Okay, next slide. So the